delighted and honored that Governor Gregoire has agreed to share her thoughts about our enterprise with you here tonight. When we're all done, you can come look at the pen. Welcome back.
First of all, thank you for the tour, but most of all, thank you for your willingness to take a risk. Obviously, this is a risk for all that are involved in this. And what Chris just said is where I think we really are, which is we can no longer afford to look at things in the traditional way we have historically. We really need to think differently, take the risks, be willing to allow folks to take the risks, and that's exactly what we're doing. And I couldn't be more excited about what's happening here. I have talked to some folks who've become investors, and basically what I would say about them is they are here to be successful, but they are also here to do good. And that's the kind of investor we want in this state, and in particular in this arena. This issue first came to my attention when there was an attempt in the past to begin a regulatory role. And I got calls from patients. And the patients said, let me explain to you how this works. And let me explain to you why we need to be able to be allowed to continue with this. That began a dialogue between myself and the commissioner saying, are we sure there's something wrong here? Are we sure we need to regulate? And he was really very engaged in wanting to take the risk, but also wanting to make sure that we didn't go down a path where we put patients at risk. And so I really very much respect the commissioner's concern, but in the end, we said this is worth the risk. And if we're not willing to take these kinds of risks, we're going to continue as a nation to have a virtual bankrupt system. Let me share with you the perspective I have as governor. In Washington State alone, we have 600,000 who are uninsured. So people might get a little excited over that, but that's not really what disturbs me the most. What disturbs me the most is those who are underinsured. Because the bulk really that we say are insured are an employer and an employee, and the family has no health care. Therein lies a huge problem for all of us. The fact that we have a system that is very inefficient. One of the interesting things at the federal level is our Medicaid reimbursement rates in this state are less than what they are in California and New York. And many other states. Do you know why? We run a fairly efficient system in Washington State, for which the federal government gives us less reimbursement. Talk about the system broken. Or how about the fact that I have gone to the administration and said, you know, I really want to begin the process of paying for results. Paying for results. Not paying for the number of times that an individual goes to see a doctor, because you all probably know how the system works. And that is, in order to get adequate reimbursement, you come back, if you're on Medicaid or Medicare, and see the doctor multiple times, because that way the doctor can bill multiple times to get sufficient funds to be allowed to continue to practice, as opposed to seeing the patient once and getting the results the patient deserves and needs, for which we pay. Got a lot of enthusiasm from the Secretary of Health and Human Services. I think this is innovative. I think this is creative. I'd like to work with you. We should pilot this in Washington State. And then the bureaucracy took over. And it is gone. And we have no ability to move forward with that concept. We began what was a fairly creative partnership with Oregon, in which we said we have got to find affordable prescription medication. So we started something unique in the country, and after 8 months, let me just share with you, it doesn't cost anything to join, okay, and there's no criteria. Some can, some can't, everybody can, as long as you don't have insurance. I mean, you can't have the ability to pay, you can't have insurance for it, but otherwise you can sign up for the program. And here's what happened. 65,000 Washingtonians signed up in the last 8 months. And those 65,000 Washingtonians have saved $1.2 million in 8 months. Wow. That was a risk. We took it. So far, so good. then I think we ought to just take it and broaden it beyond that few that we had captioned, make it available to the state, make it available to others, to make sure we can keep doing this. We've come up with a philosophy. Steve Hill is here somewhere. Where are you, Mr. Steve? There you are. Steve is head of the Healthcare Authority for Washington State. He's a guy after my heart because he keeps telling me we've got to take risks, we've got to do things different, we've got to be bold, we've got to be courageous. So what we've been trying to capture as a state is how do we ensure patient safety? How do we drive up quality of healthcare? And how do we drive down costs? Now, of course, we all want to get to everybody has healthcare. But unless and until we do those fundamental things, we will simply perpetuate a bankrupt system. And it will bankrupt us, which means that as a country, as a state, we cannot compete in the global market because our healthcare system is such a drain on the economy, and it's not the humane thing to do. So when I look at our goals as a state, whether it's evidence-based care, as Chris was saying, electronic medical records, chronic care, 50% of the population it accounts for 5% of the population accounts for 50% of the costs, whether it's transparency, whether it's human wellness, those are the things we're trying to get at. But again, our theme is drive up safety, drive up quality, drive down costs. That's what Qliance is all about. So what you're doing here in your mission is really what we've been trying to embrace. But we can't achieve it if we simply look at it through the old same lenses that we have historically. That it's a highly regulated process, that we make sure every I is dotted, every T is crossed, and drive up the cost and really drive down the lack of care that that patient needs and deserves. And I look at someone like Dr. Bliss, and I say, many of our physicians in this country and in this state went to school because they wanted to practice medicine, not because they wanted to deal with insurance, not because they wanted to deal with bureaucracy. In fact, they don't want to deal with any of that. They want to deal with their patients, and that's what they're really good at. And what Qliance has as a vision and a model is to allow doctors to do what they love and feel passionate about, to give patients like the two from whom we've heard tonight get what they so richly deserve at an affordable cost. So it's high quality, it is patient safety, and it is driving down costs. So I come simply to say thank you for those of you who are investing. Thank you for those of you who are providing the care. Thanks to those of you who are getting the care. And I just hope, this began here in our state, this whole concept. We need to keep leading. We need to keep being willing to take risks. Think differently. Think new. Have investors who are willing to take the risk. Because if we do that, we'll be able to lead this entire nation at a fundamental overhaul reform of the entire healthcare system in this country. So we get back as, yes, the richest nation in the world, but the richest nation in the world that has affordable healthcare to all of its people, that is high quality, and says we're going to have patient safety as a top priority. So congratulations, Dr. Bliss. Congratulations to all of you. Thank you, Chris, for your bold leadership. This is exactly what we and the patients of the state of Washington need. Congratulations.
To have fun and get to meet each other. There's still plenty of food. We want to thank Fair Start for helping us out, providing the food. They did a beautiful job. So eat it, please. You don't eat the leftovers. And the other thing I want to remind everybody of is if you like what we're doing, it's okay for you to refer your friends, your family, your employees. We would love to meet them all. Thank you for coming.
Thank you.
Thank you.